102.7 WMOM, Pitbull, Neo there, and Give Me Everything on your station playing your hit music. It is Mom FM, 7:20, 20 minutes after 7 o'clock on a Tuesday morning, and Dr. Cori Hayes in the studio with us from Riemer Eye Center. Good morning to you. Thanks for coming in this morning.
Good morning, Chris. Thanks for having me.
Absolutely. We've been doing these segments on vision and the health of your eyes. And sometimes your eyes become something that we don't think about until we have stigmatism, until we have an eye issue, until, like you and I were talking about off the air. Sometimes I wear my contacts too much and my contacts get dry. And that's sort of the lighter things. We can really have some serious issues with our eyes, can't we?
Oh, certainly. Many serious issues.
And over the next couple minutes, we're going to be talking about this. From adults to kids, when parents should be bringing their kids in to get their eyes checked. What's myopia versus what are stigmatisms? You had mentioned before we went on the air that you get a lot of people that ask about stigmatisms. Is there a fear of that? What are those conversations like?
Well, sometimes people think that this astigmatism is a disease, and it's not a disease. It's just a type of prescription, and it can go along with nearsighted or farsighted or by itself. And astigmatism kind of messes up everything and really is the root of a lot of symptoms for people.
All right. Well, let's chat about that. We're going to go in depth over the next few minutes on this conversation. By the way, you can watch this segment right now streaming on our Facebook page, WMOM. And if you have a question, jump in. You can comment in the comment sections and we'll try to answer it as much as possible. Same thing on our YouTube channel that's streaming live right now. Dr. Cori Hayes in with us from Riemer Eye Center. And you have been with Riemer for how many years?
Over 23 years now.
Oh my gosh, that is dedication, and you've seen a lot of patients. In that amount of time, you've seen parents turn into kids, or kids turn into parents, right?
I'm seeing the generations turn over now.
Wow, what do you think about that?
It's an honor.
That's pretty neat. Well, you're at the Ludington location, and for many years saw you in the Shelby area, right?
That's correct.
Okay. Well, let's chat over the next few minutes about this myopia. When we say that term out loud, what are we talking about?
Well, that's something that confuses a lot of people because myopia, or also called nearsightedness, that means that people have a harder time seeing the distance. So it's actually easier, if you're nearsighted, it's easier for you to see things that are near to you. Okay. So you tend to have distance problems. Farsightedness or hyperopia, it means that your eyes have to work a little bit harder for the up close, so your symptoms tend to be for the up close. But then there's this stigmatism, and that just can mess up everything.
All right, well, let's break that up just a little bit. So what creates, if we can go into the science a little bit,
Sure.
The nearsightedness or the farsightedness?
Well, it has so much to do with the curvature of the front surface of the eyes. And if the curvature of the front surface is a little bit more steeply curved, then the image tends to focus more in front of the retina and causing blur there. Hyperopia is more flatter and behind the retina. With astigmatism, it's actually curved in different directions. Maybe a flatter curve going side to side and a steeper curve going up and down. So astigmatism is power on the eyes that just goes in one direction, actually.
And do we look at correcting that? We wear glasses, we wear contacts, but is that what is defined as getting eye surgery? We're taking care of that stigmatism, myopia. What are we correcting when we talk about surgery?
Surgeries, for example, the laser surgery, LASIK surgery to minimize the prescription, can address all of those. It's easier for the nearsightedness, the myopia, and the astigmatism. It's a little more complicated sometimes for the farsighted type of prescription.
Okay. So if you have farsightedness, can that be corrected, or it's a bit more troubling for that?
It's more troubling with surgery.
Okay.
Sometimes low amounts of it can be addressed with surgery, but the farsightedness is a little bit more complicated of a surgical procedure.
All right, but can be done.
Can be done.
Okay. Let's talk about how do we self-diagnose ourselves? I mean, we do that all the time, right? We're on WebMD or everything else out there. can we actually see in this particular case signs of astigmatism, of myopia, before we get to the eye doctor?
Well, for the myopia, it's blur in the distance. It's difficulty sometimes seeing signs in the distance.
Okay.
Road signs for children, seeing the board at school, seeing the TV, squinting to see it. The farsightedness symptoms are more likely to be up close. So eye strain when you're doing up close work, or it just goes blurry on you. Astigmatism tends to affect us more for our vision in the distance, especially like nighttime driving, glare of the headlights, that type of a thing. More for the comfort of our eyes for the up close. So common symptoms, headaches, especially temples across the front and brows and behind the eyes, and eye fatigue, difficulty going back and forth, looking maybe at your phone and then looking up to see the clock or the TV. Those are some common symptoms with astigmatism.
And if we ignore it, can it get worse? Is my first part of the question. But if we tackle it early enough, does it still get worse? Does that make sense?
It really can get worse or better. Sometimes it improves.
Okay.
Addressing it isn't necessarily going to make a difference. So much of our vision changes can come from just changing. All the cells in our body constantly die and regrow, so things remold. But if we're always straining to focus, our focusing system sometimes can get locked up in a state kind of as a spasm and kind of continually become more and more of that.
Okay, good information. We're talking with Dr. Cori Hayes from Riemer Eye Center this morning, something you can listen to on your radio, your smart devices like your Amazon Alexa, Google Home, streaming at WMOM.FM, and our Facebook and YouTube Live is activated right now, too. When it comes to kids, parents and kids, we're not, is our kids actually saying to us, hey, I can't see the board at a certain age? How do we when a child's 2 years old, 3 years old, 4 years old, can they actually relay that information to the parents, or are the parents seeing something in their children?
So often, kids don't know. Kids don't know that they're having any troubles. They don't know what they're missing. Sometimes adults don't know what they're missing. But kids especially, if they don't know what it's like to see well sometimes. And so I talk to parents and teachers about watching for signs for the kids, watching for them squinting, especially if they're squinting just one eye. Sometimes that's a sign that one eye is really having problems, maybe a lazy eye.
Okay.
But squinting, getting close to the TV, struggling in class to look up at the board, and especially if they're going back and forth and they have kind of focusing of their brow, then it can be a sign that they're having a little bit of struggle. And
do you see kids? I mean, how early do you see children getting into glasses, as an example?
Oh, earlier and earlier all the time, and so much of our world is digital devices, so that the symptoms are coming across earlier and earlier than what they used to. We always recommend that before a child starts into school, we do a full comprehensive eye exam. We at the schools, they do screenings, but screenings are screenings, and they do a good job through the health department and through the Lions Club, but they're just wanting to know, can this child basically see, and are their eyes basically aligned, and they're not detecting internal health problems, and they're not detecting kind of some of the subtle signs that the child may be prone to difficulties and struggles with school.
You know, one question that might come up from a parent is, should we perform eye surgery on a child, on a teenager? When does that point become, and I use the word safe, but it's a safe surgery in itself. When is it acceptable that's okay to have that surgery? For what age?
Are you talking more for refractive error?
Yeah, for correcting
Usually
those.
they won't do any surgery for refractive error to help minimize glasses prescription until they're at least 18. And they
Okay.
have to have established a relatively stable prescription before, even with adults, before they'll even think about doing surgery.
Because there's a point where your vision, I don't know if that's even a fair response, but it can become stable, right? And that's more towards the adult
Certainly.
range?
Certainly.
Okay. We're talking with Dr. Cori Hayes this morning, Riemer Eye Center. This is a segment that we do each month to help the listeners and the viewers out there in regards to your eye health. And I asked this question to each of our doctors that come in from Riemer Eye Center, is how important, it's a two-part question, how important is our eye health? And the second is, how much do we neglect it, do you think, in your opinion? You've been with Riemer Eye Center for 23 years. You have seen probably every particular situation, right?
Oh, absolutely. Well, the eyes truly are the window to the soul, and there's so many things that we can help to notice by looking inside the eyes, and especially when we do our dilated eye exam. That's why it's so important for that. And nobody likes getting their eyes dilated, but we really get so much more information. We're able to look inside the eyes, at the health in the back of the eyes. We're able to see the arteries and veins and the nerves, and it's the one place where you can look at that stuff in action without having to cut or to poke. And so it truly gives us such a look into what the potential is for the health of that person.
And by the way, I had my eyes dilated a few weeks ago. What happens in that process? Because our vision is just like, I can't see when
Right.
that happens. What is that science behind that, if you don't mind?
So it's basically paralyzing the muscles. There's two parts. It's paralyzing the muscles that contract to focus to make your pupil smaller with the response to light. So it's basically paralyzing those muscles so that they're frozen bigger and they can't contract. But it's also paralyzing the muscles that control the flexibility of the lens behind the iris, the colored part of the eye. And it knocks that out. So helpful for us, especially with children, to really get their true prescription. I call the eye drops the truth serum for the eyes.
Okay.
That it forces that focusing system to chill and to relax so the true full prescription comes out and the eyes can't hide any.
All right, good information here, and I appreciate you coming in. We've got a few more questions for you. The difference between single vision and bifocal lenses, and my first question in regards to that is, do you have to have lines in your glasses these days?
No, you don't have to have lines. And usually for most people, the no lines, or we call them multifocals, or we usually refer to them as progressives. Progressive has a gradual change of the power from what's usually your top part that we customize for your distance prescription and the strongest part on the bottom for your near prescription. But because of the gradual change between the top to the bottom, for any distance from far away to up close, you have somewhere in there that's for that distance versus a lined bifocal where there's only two choices of powers.
Yeah.
And given one power, there's sometimes limitations to the range of vision that you get out of that.
Okay. So either you're looking up or you're looking down.
Correct.
Right. And single vision, can I assume that is just, again, if I think I'm a 3.75 or something like that. That is going to be my vision as I look to the near side of things or far side of things. Is that right? Or am I wrong on that, on single vision?
A single vision, well, we customize it according to what you want that for.
Okay.
That might be customized for the distance prescription, which is most often what we do that for.
Okay.
But we sometimes customize it for computer. Or for reading glasses. But if you're usually past low to mid 40s and starting to have a little bit of difficulty up close, then given just one power, then one pair of glasses doesn't necessarily cover everything that you need to, and that's where our multifocals, line or no line bifocal, comes into play.
All right. Do you see majority of people wear bifocals or single vision lenses?
Well, most people, once you get past low to mid 40s, most people nowadays are getting some sort of a bifocal. And what I always say is a bifocal doesn't mean that you have to wear your glasses all the time. It just gives you the choice that you can be able to read but still look up and see far away without having to peek over the top or take them off.
All right, this is good information to discuss this morning. We're talking again, Dr. Cori Hayes this morning. Buying glasses, I just went through that process at Riemer Eye Center. I got a pair of glasses, looking forward to them this week. I got contacts at the same time. I tend to wear contacts more than my glasses. But what's important when buying glasses? For me, if I can inject, it was not having a super thick lens. Because I bought frames that have kind of an open bottom on it, so I didn't want that thick lens. But what are other factors when it comes to buying glasses?
Well, number one thing in choosing frames is also thinking about the prescription to start out.
Okay.
And a person with a higher prescription, there's things that you can do in your choice of the frames to optimize how those lenses are going to look and how heavy they're going to be. You want a frame that is as small as you can get to keep the thickness and the weight down, but still be big enough that it's not squeezing your head and likely to cause your glasses to slip down in your nose. Number one thing that I think about is I start when I'm looking at a frame, I start at the front and the middle, and you have to make sure the bridge of the nose fits just right. Otherwise, you're going to certainly have a less than optimum experience with them. And especially if they don't have nose pads, if it's a plastic frame, it really has to fit the bridge of your nose just perfectly.
Yeah.
And with the nose pads, it's a little bit more adjustable. And you kind of take the Goldilocks approach. You don't want them to be too wide, but you don't also don't want them too thin. And you want your eyes to be centered horizontally in that lens. If that lens is, if your pupil, the center of your eye is more centered in that lens, then you're going to have a more cosmetically pleasing set of glasses, and the sweet spot of your glasses is going to be more bigger.
Okay. And because when I was a kid, I would see like the bruises on my nose from just heavy glasses or not the right glasses. If we have those spots on each side because of the nose pads, is it a good indicator that we are in the wrong pair of glasses?
Sometimes some people just have more tender noses and more tender skin right there, but it certainly can be a sign that's just not the most optimum frame for you. Some people who it does tend to be tender, they might be better with a plastic frame where the weight of the frame and the lenses is more distributed evenly across the entire bridge of their nose.
Okay. Finally, contact lenses. Do you see more people prefer contact lenses than glasses? Where are we at in regards to percentages, do you think?
Oh, it's so varied with it. It really is. We have more options now with the contact lenses for the presbyopic, which is the bifocal type of necessities, and which is so critical because we have such near demands. More of us have near demands on our eyes than what we ever had before. And in the past, we didn't have as many options for those people who wanted to continue to wear their contacts as a primary source of vision correction. And we've got more options now in these last several years that can even do the astigmatism with even a multifocal type of contact lens.
And you don't have to put it in a certain way or anything like that. It just does its job.
Correct.
Wow.
Correct. It's a little more difficult. There's a little more work that goes into it for all of us, but more options than what we've had in the past.
And technology-wise, at Riemer Eye Center, you have invested in amazing technology there. We always talk about that. So it's well worth going to Riemer Eye Center for these checkups and to answer these questions. Overuse of contact lenses, can that damage our eyes over time?
Oh, certainly. That especially even lenses that the FDA has approved for an extended wear, meaning potentially sleeping in your lenses, you're still more at risk for bad things to happen, vision loss, corneal ulcers, and potentially even going blind. But so you're still better off to just be in the habit of taking them out at nighttime and giving your eyes a chance to breathe, to get all the full oxygen that they need, and to recover from the wear.
And we hear that from our doctors, at least I have over the years, that you got to make sure you take your contacts out. You've got to get oxygen to your eyes. My last question for you in regards to oxygen in your eyes, that is important. And from a science standpoint, why?
Our eyes are the cells in our cornea, which is the clear dome on the surface of the eyes. They need oxygen to stay hydrated and to stay clear, and for those cells to work optimally to also keep fluid from out of our cornea. We keep fluid where it's supposed to be. Okay. And lack of oxygen causes those cells to kind of swell and become cloudy.
Okay. All right. Well, with lots of information this morning, anything that we missed that we want to share with the audience before we wrap up, do you think?
I don't think so.
All right. Covered a lot. If you missed any part of this segment, it's going to be archived right there at our Facebook page and our YouTube channel. Dr. Hayes, we appreciate you coming in and chatting about these topics that we cover each month. Important for making sure that we can, see the sunset at Stearns Beach if we want to, or go for that walk in the state park. Our vision is important to be able to see our kids, our family, be able to interact with people, and the opportunity is there to correct these things, or at least get them checked out, so that we're put on the right path now before it's too late, right?
Correct.
Absolutely. All right, Dr. Hayes, thanks for coming in this morning.
Oh, thank you, Chris. It's a pleasure.
Absolutely. Dr. Cori Hayes from Riemer Eye Center. 3 locations in Ludington, and Cadillac, and Manistee. Give them a call, check out their website, and hopefully we've given you some good information this morning to start you on the right path, but they can get you there where you need to go. It is 7:41 now on 102.7 Mom FM. Coming up this hour, SZA, as well as the Kid Leroy and Justin Bieber. Stick around for that and more on 102.7. It's Mom FM.
We at Safe Harbor Credit Union